Welcome everyone to Healing and Treating Lyme Disease in Children, a naturopathic approach. Today at the Lyme Disease Resource Center, we are welcoming Nitya Jessica Eisenheim, a naturopathic physician whose practice is in Greenfield, Massachusetts, and it's called Cedar Rose Naturopathic. Cedar Rose Heals. And we're just very excited to have Dr. Eisenheim here again, post-pandemic and in a virtual environment, to talk a little bit about Lyme in children. And please, thank you for coming. Yeah, and please start.
Okay, great, awesome. And then thanks everybody for coming and taking time out of your busy schedule to be here. I really appreciate it. So I'm excited to share some things with you today. And yeah, this is me, Nitya Eisenheim, a Lyme disease healing expert. And then we can go to the next slide. So we're just going to do a little overview of what we're going to learn. The main things is a lot of the things that you had questions about. So learning how to prevent Lyme tick-borne illnesses, what to do if you find a tick bite, what the different phases of tick and Lyme disease-borne diseases might look like in children, and then my unique 9-step approach to Lyme recovery for children. And also just to say, yeah, children heal really remarkably well, and the sooner we can get treatment, the better. And people, it doesn't have to be a big long-term debilitating illness if it's treated early, and a lot of it's recognizing the signs and symptoms. Okay, so now next slide. So just a little bit about me is my family has all had Lyme. One side of my family is all from upstate New York, and this was like way before anybody was even Lyme literate. Everyone was pulling all their ticks off of them and just throwing them to the side or whatever. And so my husband and his brother and his mother and the dogs, they've all had, they've had all the co-infections, they've had everything, and they just really suffer a lot. All kinds of symptoms, pain, fatigue, brain fog, neurological symptoms, burning, horrible muscle pains, and, unable to work. And my mother-in-law didn't get treatment in time, and she got Lyme maybe 20 years ago now, and she's 75 now, and she's just declining like really, really fast because she wound up having chronic Lyme, unfortunately. So yeah, so I have a lot of personal experience with it, and I felt really hopeless, with all this suffering going on and just a frustration with not getting treatments and getting nowhere with doctors. So when I was studying naturopathic medicine in Seattle, where I went to naturopathic school for 5 years, my husband started, there was a lot more Lyme literate MDs and NDs out there than here, even though there's less Lyme disease in Seattle, like in the Washington state. I don't know the numbers are, but it's a lot less than in the Northeast for sure. And but there was a lot more Lyme literate doctors, and then it was just overwhelming, like all the information, and then learning about it at that time. So I've really learned the most from, I probably worked with like 500 plus patients now of all ages and all stages of Lyme disease. And I've really learned the most from my patients. And I, really owe the Lyme disease recovery system to them. And just, we can go to the next one, which is related, is I also have a 4-year-old daughter. This is her when she's probably like 18 months or something. And I really just want parents and children and people that are caring for children in any kind of way, professionally or just in your family, to know that there are real treatment options available that don't have to include taking antibiotics for years at a time. Some people choose to do that, but sometimes for children, it's not appropriate, and we also don't need to do it. So we want to know there are treatments available and how to recognize it. And we can go to the next slide. And just a little bit more about me and my practice is that children and families come from all over the Northeast, and now really from all over the country because of telehealth. People come as I help them through the 9-step Lyme recovery system. And because I'm a naturopathic doctor, we're talking about Lyme, but I also help people with autoimmune disease and digestive issues and all the things that can be related to Lyme and so forth. And in terms of my training, I'm a naturopathic physician. I'm licensed in Vermont and Massachusetts. I have to do 50 plus continuing education hours every 2 years. And I went to a 4-year in residence naturopathic medical school that's recognized by the Federal Department of Education. And when you kind of compare the hours to like a DO, like doctor of osteopath, or MD, medical doctor, it really winds up being the same amount of academic and clinical hours. We just started to do it in a really shorter period and condensed period of time. I did it in 5 years, so I wouldn't go crazy. And after that, I went and I worked with Dr. Mayela at Windhorst Naturopathic Clinic in Brattleboro, Vermont, and it basically was a residency, just not officially that way. I worked with her for 3 years, and that's a clinic that focuses on chronic illness, specifically autoimmune and Lyme and tick-borne illnesses. And then I also did primary care there for 3 years. So I really treated a range of patients in all stages of Lyme disease, and I've learned a lot from them. And I've shared patients with some well-known doctors in the area, such as Deborah Hoadley, who is a medical doctor and also has an MPH, Master's in Public Health. And then I did share patients with Dr. Charles Ray Jones, who recently passed away. He was a pediatric Lyme specialist. And I just learned that. So I was like, oh, wow, I didn't know that he just passed. And conventional medicine has a lot to offer. It's not like it's bad. Sometimes we need drugs and surgery. And there's other times where natural medicines make more sense. And this is just one perspective amongst many, but always contact your physician for medical advice. And this talk is for educational purposes, not for medical advice. And then and I can go into the next slide, is that treating the whole person is one of the 6 principles of naturopathic medicine. And it's really what's kind of part of what is the unique way that I help and treat children and people in general. Because I'm not just focused on killing the Lyme or the anaplasma or the virus or whatever, but we're going to look at the whole person. And in traditional medicines like naturopathic medicine, Chinese medicine, Ayurvedic medicine, we're looking more at the person and health and focusing on health and not focusing as much on disease. And I've just found working with in my practice, working with so many people that we do need the antibiotics, when we have acute Lyme. But usually in my experience, I found that after 6 weeks of antibiotics, most people reach a plateau at some point. And I've had patients that I've worked with that were like on it, working with another Lyme literate doctor and on IV antibiotics, and they choose to do that. And then some people choose to transition off. But usually at some point, it's you kind of reach a point and there's a plateau and you need to do other things, my experience. So even places that sometimes say they do integrative care often don't really do that, in my experience. And so the next slide about where we're getting things from, and someone wants to come in. So prevention is key. We know obviously that Lyme and tick-borne disease can spread via tick bites. And we'll go through more details on the different types of ticks in a second. So because the talk is on children, we also need to talk about how it could be spread through pregnancy to the unborn child if the pregnant person is not treated appropriately. So we know Lyme can cross the placenta. It can infect and harm the unborn child. And scientists have known this since 1985, but the CDC did not recognize this until 2020. And then studies show that there's fewer adverse outcomes for the child and for the mother, pregnant person, when there's antibiotics are prescribed by a Lyme specialist. And Dr. Charles Ray Jones, who I just mentioned, he interviewed 102 mothers who gave birth to children while they were infected with Lyme. And most of the symptoms, like they say, most of them describe their pregnancy as difficult, with the symptoms being severe, unremitting fatigue, brain fog, like cognitive problems. And if you've ever been pregnant, you know you could have all these things without having Lyme disease. They'll just say it's just you're pregnant, right? So it's really easy if those are just your main symptoms to kind of, no one's going to probably test you for Lyme, and then your child could get it. Pregnant women treated who have Lyme often don't carry to term, and there could be stillborns and miscarriages and sometimes deaths with cardiac abnormalities. And then in that study of 102 live births that Dr. Charles Ray Jones did, he talked about the most common symptoms of the newborns were neuropsychiatric. And that's kind of what I want to like drill into is neuropsychiatric. They may not have a fever or a rash. I mean, they might, but sometimes it's just like all of a sudden they start having tantrums and mood swings all of a sudden. And, you could say, oh, it's just a terrible twos. And maybe it's not. If you knew there was a tick bite, then you want to get them to someone Lyme literate. So 80% of children, and these are the children born with the pregnant mom being having Lyme and not being treated. So 80% had cognitive problems, learning disabilities, and mood swings. 72% had fatigue and lack of stamina, and 9% had autism. There was a pregnant mother that I treated with Dr. Mayela when I was working in Brattleboro, Vermont, where we can prescribe everything. And she came in the second trimester, and she had mostly her main symptoms were fatigue and pain, and she only tested positive for Borrelia for Lyme. So she didn't have any of the co-infections, so that made it easier. And I think mostly Dr. Myla, I don't think she worked with any other doctors, but she received the antibiotics, and she was treated pretty quickly. I don't remember. Yeah, I think it was mostly fatigue and pain, but she knew she had a tick bite, so that helped. And also where she lives, in this area, there's just a lot of ticks. So she was lucky that she got treated early with antibiotics, some herbs. You can't use a lot of the herbs in pregnancy, but she did have some herbal treatment and some supplements. It's just you have to do a lot less when you're pregnant. And so she was fine. She did have some fatigue and pain that got better once she got treatment. And then she was fine. The birth was fine. The child was fine. There was no issue. So it doesn't have to be horrible. It doesn't have to be that way. And then we ask, what about breastfeeding? We get that question a lot, and you see a lot of different information online about that. That's very confusing. So CDC info is like, oh, well, we know there's no reports of it. There's no cases of it. They're only looking at like Lyme, though. They're not looking at co-infections. And this is the yet, right? Like there's like, oh, no reports yet, but we know that Borrelia is carried could be found in breast milk. So the main thing is like, if you think you have Lyme and you're breastfeeding, like just like out of any other infection that you have, like mastitis or something else, if you're breastfeeding, you're supposed to stop breastfeeding, pump, and hopefully you have like milks. They'll have milk saved that they can give to the baby, so you don't have to do formula. And then you get on the treatment, you get on the antibiotics, work with a Lyme literate doctor, and then once you're on treatment, then you can start breastfeeding again. You just have to use different antibiotics. You can't use doxycycline. You have to use Ceftin, and you can use some of the herbs, like some of the main herbs that we use, like Japanese knotweed and Smilax and Andrographis. Even though they're strong, a lot of those you can use a lot of those herbs safely, but you really need to work with somebody who can guide you on that. And then once you start treatment, you want to start breastfeeding again. We'll go back to that. Okay, next slide. So we have the different types of ticks. Actually, let's just go to the picture so we can have a little break from the. So this is a tick ID card from the Massachusetts Department of Public Health, and they're really great to just carry around. And so we know deer ticks. Most of the people here today are from Northeast, right? So we know the deer ticks. On the left here, we have the nymph, This is the male, this is the female. These are mostly what we find in our forest here in the Northeast, but they can also be in the Midwest, Mid-Atlantic, and the South. What's interesting about the South and the Southeast is that, well, they have Lone Star ticks, which carry more disease, but the deer ticks, they have more deer ticks than we do, but their deer ticks don't carry as much disease, because I learned from somebody last week was that because their main vector are not mammals, they're reptiles, and they don't replicate as the bacteria don't replicate for some reason when their hosts are reptiles. This is what I learned from like a scientist last week. So anyways, thought that was interesting tidbit. The females have more of the red, but you can get infected by a bite of the nymph. There's a myth that you won't get Lyme disease or any tick-borne illness if you're bit by the nymphs. The nymphs are out a lot right now, and they're just like these little tiny flecks that look like a piece of dirt, and then you look closely and there's legs, and you want to get them off, get them tested through the tick report. But they can carry disease. And the deer ticks carry Borrelia, Ehrlichiosis babesia, Bartonella, and now Powassan virus is the newer one, which is a pretty fatal one, and can cause, I think when it goes, we call neuroinvasive, where it infects the brain and the spinal cord. It can be fatal in like up to 12% of people. So a lot of times when you hear about this one, it's like when people are in the hospital or something, they're in their ICU, and it can be pretty serious. And they don't have treatment conventionally for this, but as I was asking about when we were talking earlier, I was asking about Alexis Chesney, who's a naturopathic doctor who worked still works at Sojourns which is a Lyme clinic in Vermont, another Lyme clinic up in southern Vermont. And she worked with Bonnie Bloom in Blue Crow Botanicals. And they together, they did a lot of research based on the research from St. John's University. They came up with all these formulas for all the tick-borne illnesses, and they have like 3 different formulas for the Powassan virus. So there is naturopathic treatment. There's a lot that you can do naturopathically for viruses. Even when someone's in the ICU, there's always there's always something you can do with homeopathy usually in those cases. But anyways, I just thought that was interesting. And then dogs' ticks do carry disease. There's a myth that they don't carry disease, like in the Northeast. A lot of other places. So dog ticks live all over North America, really. So also including like Mexico and stuff. But these are the female ones, and these are the male ones. They're pretty distinctive, and they can be more squishy, whereas the deer ticks can be more hard, depending on kind of how engorged they are if you find them attached to you. But the dog ticks, where I'm noticing a lot more dog ticks where I live in my area. And in some ways, I think it's good because in the Northeast, they're not carrying a lot of disease. They do carry Borrelia a lot of the time in other places of the country, like even just a little bit further south, like Pennsylvania and like Mid-Atlantic and Midwest. And they do carry a lot more disease, like Rocky Mountain they can cause Rocky Mountain spotted fever. They can carry ehrlichiosis, anaplasma, Francelia, which is called like the rabbit fever or something. You can also get that from rabbits, apparently. So they can cause disease, but in this part of the country, in the Northeast, they usually don't. But they do often I have had patients that have gotten Lyme, or they can carry Borrelia, is what they tend to carry. But they carry a lot less in this area. And so in some ways, it's like, oh, there's like all these dog ticks everywhere that are biting me, but they're not as bad. But all the ones I've sent in a tick report have been negative, which is good. But they tend to bite on the head. And what I learned is that, and maybe that's why the picture isn't in here, but the nymphs of the dog ticks only like to feed on rodents. They don't like to feed on mammals. Or on humans anyways. So I thought that was interesting. And then, yeah, I've always noticed that they bite on the head. Like I always find them on my daughter, on her head and her hair. And then we go to the next one, the Lone Star tick. If there's anybody from the Southeast, is usually we would, in the past, we would say, oh, this was just in the South and the Southeast. And once in a while, people would get dogs and buy them from the South and bring them up. And then you could get a Lone Star tick that way. But we're seeing them come up to Maine now. So, I mean, they're because of warming temperatures and the rising white-tailed deer populations, their range is increasing, and so they're coming up to us. So Connecticut, I think they've been found in Connecticut and Maine, and they can carry a lot of disease. These are not ones. These are pretty nasty ones. They carry 2 types of ehrlichiosis, heartland virus disease, southern tick associated rash illness, which is kind of similar to Lyme, another virus, and they also carry Francisella. So those are the females are pretty easy to identify, but the males have this other sort of like black pattern, and they're lighter. They look lighter than the other ticks. But usually when you send them into a tick report, they'll identify them for you. But it's nice to identify them to know if you want to send them in or not. Because for some, like I'm not going to send in like every single dog tick to tick report. I stick them in I squish them, stick them in a bag, label in like a Ziploc bag so they can't, in case they are still alive, make sure they can't get out. Or you could put them in a jar, and I label them with like where I was bit, or where my daughter was, location of where you were bit, where you found, if you were in the garden or if you're in another part. Like, it's different town to town. Like in my town, where I live in the hills, it's like the forest is more intact. So there's a lot less disease that the ticks carry. And then when my daughter would go to daycare and get bit on her head, like from another town, like more in like the lowlands and in the valley, where there's more disease. So sometimes I write on their location, the town, or like whose house it was, whatever, and then anything about the bite, any symptoms, and I stick it in the fridge or the freezer in case there are symptoms that come up. That's what I do with the dog ticks, because I don't send in every single dog tick. Okay, so we can go to the next one. And so tips for prevention, really for children. You just have to, and for everyone, you just have to find the strategy that works well for you. Like, I feel like you see this, all the things that you see written about prevention don't always work for people they're more for people, I think, that like live in like a city or a suburb and then go to walk on a trail or something like that. And then they come back and there's this like distinct separation between the outside and the inside. But I don't know, like where I live and like where a lot of people, like where a lot of us live, we live in the woods, or we live in like a lot of woodland areas or prairies or grasslands. And it's just, there's not this distinct separation. And so there's ticks inside the house sometimes, right? And so you have to find the strategy that works for you, especially for small children. They're not gonna like walk around with their socks on their pants and all of that. They're like ripping off their clothes and running around without their clothes half the time. So, with small children, what's really easy is just like they're changing their clothes so many times. And so whenever they're going to the bathroom or changing their clothes, it's just a really good time to do a chick check. And they don't have a lot of hair on them. They don't have a lot of surface area. It's like you can just sort of do it without them even knowing it, right? Sometimes I'll just do like, okay, we're taking your shirt off. Let's look, and you don't even have to make a big deal out of it. And that's kind of the big thing too, is not to like be really anxious when you're doing tick checks especially with any children, but with the young children, they pick up on all that. So just kind of making it like matter of fact, making sure they know what ticks look like, and they tell a grown up or an older child if they do see a tick, and get it off as soon as possible. I know at my daughter's preschool, they do tick checks. Like whenever they're coming back, they go out to their trail, and then, they check their hairline and they check their ankles. So I think like developing all those things that just become normalized and aren't like, oh, this big deal, and like something that we need to be really scared of. It's a good way to approach it. And, just making sure if they have a lot of hair, haircuts are good for spring and summer for small children. We cut my daughter's hair, but she still has like really thick, dark hair. And so I just I find a way every night to sit her down. Usually it's with like a 2 or 3 minute blue video, because that's the only way she'll sit. Some children will sit and color or like play with their toy, but my child won't do that. So we have to use a video, and we sit her down every night, and I just get the headlamp on, and I like look through all the hair, and I just make sure there's nothing there. And if there is, we pull it out and decide what to do with it. So with older children, and don't forget the clothes when you're doing tick checks. Like a lot of time, I feel like a lot of my patients, especially that are out all the time, either doing landscaping or gardening or, they're whatever they're doing, that trail maintenance or something, then they're really tired. They get home, they throw off their clothes, they do the tick check. And then the next morning they found a tick on them because they probably didn't do something with the clothes. Like a lot of times so you either need to look at the clothes or put them in the dryer for 5 minutes on high. That kills the tick usually. Or put them outside somewhere, but so the tick crawls off. But then, some people, you have to find what works for you. Basically, there's a lot of different ideas. I do think it is still helpful to do some kind of essential oil spray or blend behind the ears and the hairline. Geranium, lemongrass, eucalyptus work well. Neem works really well. And wormwood oil also works well on the outside. For children, so for adults, I used to recommend everyone do the permethrin spray on their clothes and boots. And I still think that's good for adults because I used to do that in the past and then never find any ticks on me. So that it does work really well. And you only have to usually spray like twice a year. You spray your clothes outside, you leave them. Okay, go through the wash. I think it can go through 30 cycles or something. But you don't want to do it near your garden or anything because it is a insecticide. I don't usually recommend that for children though. So you could do their boots maybe, but some people, I kind of recommend that less just because I don't usually recommend it with children, and then I don't always like recommending doing insecticides. If you have pets, get them treated, but remember they're probably going to, even when they're treated, they're going to bring them inside. So that's why you got to just do at least 2 tick checks a day when you're changing your clothes in the morning and in the evening before you take a shower or a bath. And then I have a tick kit that I try to have most of my patients buy and have on hand, and it's used for prevention and for treatment. And so for prevention, when they're having people do one of these things, either the Lyme Away glycerite, this way, and this has the basic Stephen Buhner formula with astragalus. So it has andrographis, and there's a slide where we'll go through more of this in a little bit, but it has cat's claw, andrographis, smilax, and astragalus in it. And Japanese knotweed. And usually for adults, it's 1 dropper full a day is the prevention. And then this is a glycerin. It's not a tincture. So there's no alcohol in it. And the tick pathogen no-sode. So I usually have people do either this one or this one. This is a homeopathic preparation. And both of these are available for sale for anybody. Patient, you don't have to be a patient to buy them. And the tick pathogen no-sode I like because I only have to do it once a week. So that's the one I choose to do usually because it's easy. I find it easier, but some people like the everyday thing. And the idea with the herbs is that you are giving your body, you basically have a little bit of the herbs that treat and kill the Lyme and the co-infections inside of you. They're in your bloodstream so that when they do bite you, you can start fighting them right away. And then the no-sode is a homeopathic preparation. It's usually a dilution of a bacteria or a virus. And this is everything that you can get from a tick. It even has stuff that the Lone Star carries. It has the rickettsia and the Franciella, along with Auriculaeus, babesia, Borrelia, and a bunch of other stuff. And this is just a couple of drops once a week, which is nice. And the tick kit has other stuff in it too, but that's usually recommend doing something. Some people will just do astragalus, glycerin, or tincture or capsules, because that's also an herb that just helps the immune system be a little bit stimulated so that if you do get infected that your immune system's like ready to go, basically. And then just knowing the symptoms. So there are the typical symptoms like fever, rash, chills, flu-like symptoms. But with children, it's often like neuropsychiatric symptoms, and sometimes there's no fever, but it could be fever with sudden change in mood, temperament, and behavior. It's typically what we see. All of a sudden, they just start raging. I just saw a 8-year-old girl last week who, when she was 3, had a tick bite. And then pretty soon after that, I don't know the time length exactly, but sometime after that, she never had a fever, never had a rash, no pain. Like, as far as they could tell, no physical symptoms. But then she just started having uncontrollable tantrums, like for like a long period of time, and like hasn't stopped since then. And she's 8 now. So sometimes it's just that. And I'll go into more of the symptoms, other symptoms in a little bit. So we'll go to the next slide. Oh, and also just teaching children, like to stay on the trails and all of that. But, they're going to play and do what they want. So you kind of have to decide as a parent or a caregiver, like what you want the rules to be around that. If you say you want them, you try to have them stay on the trail, or you want them to jump in the leaves or not. Everybody has different feelings about it. So so what to do if you get a tick bite? Okay, so we want to remove the tick as soon as possible, and tick spoon is great for children because I think it's like it seems less scary to them, because with the tick spoon you can just move the tick around until it comes out, but it just will start crawling out. So you have to be prepared to catch it. Don't let it get away. And then just noting, how embedded it is. You can use the traditional tweezers, pull up and away. But I think I found like with kids that are just like squirming around a lot and not able, like little kids, it's harder to do that. And the tick spoon, you don't have to worry about like any parts getting stuck in. Sometimes takes a little bit longer. Sending it to tick in for testing through tickreport.com, which we had mentioned before. And that's anybody across the country can send that in. You can mail it in, and it doesn't have to be alive. I've had people send in dead ticks, but you can't send in like one leg, you don't have to have the head, but you don't have to have the whole body either. And that's just more effective. It's way more efficacious to test the tick than the person, because you could know, right? It's like usually I have people, okay, you're sending in the tick for testing, start on some herbs, and then usually it's like 2 or 3 days later the tick report comes back, rather than like see at the bottom here, you could test yourself 4 to 6 weeks later, but why do you wait that long? So, and just a caveat of that is like, there are some providers who really don't like, who are still saying like, no, don't send the tick in, no. And it is true that sometimes you could have symptoms that came from another, like you could have other ticks that you didn't find, and there's always true. But I found in my practice that, if you had a tick bite, then you have symptoms, then we can just get started on the treatment much more quickly. You don't have to do all this waiting thing, and then you're more sick. So then we do start on the same herbs and homeopathics, but a couple of different ones that are in the tick kit. I usually recommend for the homeopathics that people do a Ledum 200C, which is for the tick bite itself, so that it stays what we call superficial, but it doesn't go really, like it just sort of stays at the level of the skin and the blood and doesn't go really deep into the tissues yet. And then the next day people do Hypericum, which is for like preventing any nerve issues or neurological issues. And then a month of the tick pathogen nosode, which we had mentioned before, and then and then getting on the herbs. So I have people do a number of different things, and usually people are doing that with antibiotics. And it comes with the tick kit comes with the protocol, so you don't have to write everything down. And there's somebody who asked about like dosing for children. Is that person here? I guess we can go to that question later, but Yeah, I usually just kind of have a guide in here, like for adults, it's 12 dropperfuls a day, except people that are more sensitive just take what they can, basically. And children tend to be more sensitive. And I just have like a general guideline. Where is it? I lost it. Oh, here it is. So ages 2 to 5, 1 dropperful a day. This is if you find a tick bite. Ages 5 to 8, 2 dropperfuls a day. Ages 12 to 8, 3 dropperfuls a day. And then 12 and up is the adult dose, which is 12 dropperfuls a day. With kids, usually have to do, get them. My daughter will generally, she's used to taking herbs, but if children aren't used to taking herbs, you might have to put it in juice or popsicles or something creative like that. And these herbs mostly just cover Lyme, just cover Borrelia. Some of these herbs also treat some of the co-infections, but that's also why the tick report is helpful, because it will tell us exactly what the tick was carrying. So if there's anaplasma, you also get on anaplasma herbs. And then this is like before, and then if you do start having symptoms, go right away to get the doxycycline, either from your primary care or from urgent care. I'm not able to prescribe antibiotics in Massachusetts, so you can also go to a Lyme literate person in your area. I usually suggest for like young children, or if it's the first time with Lyme or co-infection that you find the positive tick report, or it's like a complex child with multiple chronic health issues, like it's usually better to book an appointment and not just follow like all this, because these are just standard protocols. If you do start taking an antibiotic, you want to take a probiotic, and then it is still suggested to test for Lyme and co-infections 4 to 6 weeks after the tick bite. Okay, so we can go to the next one. And then this is briefly why you might be at risk for Lyme disease if you took antibiotics and you're still sick, or if you didn't see anything. So fever, fatigue, just never felt this tired in your life before. Can't get up and do anything. Digestive upset, sudden onset. A lot of things are like sudden, not usually subtle when there's like an acute Lyme going on. Just sudden onset of diarrhea or nausea. Could be change in bowels in any way. Brain fog and just memory issues. Sometimes hallucinations even. Any extreme pain. It could be migrating pain. And then sudden intense mood swings, anxiety, depression, rages, surges of energy, and then a rash of any kind. And sometimes there's multiple rashes that we see in disseminated Lyme. Especially like if you're, you just were outside a lot, you just went away on a trip for a while, that you were outside a lot and you're getting some symptoms, then you want to go to Lyme literate person and get tested. Okay, next slide. All right, so there are different ways of looking, and there's stages and phases of Lyme disease. I kind of use more the acute, subacute, intermediate, and chronic language. But sometimes people use this. There's like usually stage 1 or acute, where it's early localized Lyme disease. There's like fever and rashes and maybe some pain starting, but it's not like quite spread out throughout the body. And that's usually maybe 1 to 2 months. And this is all like, this is just general, it doesn't always play out like this, because bodies are different, people are different. And also the illness, the pathogens are different. And then stage 2, which I kind of consider like intermediate or subacute, is usually like 3 months to 1 year. And that's where it's starting to spread more throughout the body. We're getting more symptoms, sometimes more nervous system symptoms show up at this stage, and more pains and headaches and bowel issues. But it's not quite like deep into the nervous system yet until stage 3. It's like the late disseminated, where it's just really all over, and it's a lot more neurological symptoms predominant. and like what we call like mental health symptoms. I call that chronic, but really there's sort of about two types of chronic, because conventionally, when they call like non-Lyme literate MDs, or like at your primary care, there is a diagnosis now called like post Lyme disease treatment or something syndrome. And so they are recognizing like, okay, you took the antibiotics and you still have all these symptoms, right? So there could be an active infection, but a lot of times it's more autoimmune. And there's not a lot of conventional treatment for autoimmune disorders or autoimmune dysregulation. And that's where naturopathic medicine can really come in, because we have a lot to offer with that. And we know how to treat chronic autoimmune diseases really well. And then so there with the chronic, there's like two phases. They're like, okay, it's sort of you didn't get treatment enough, or you didn't get the antibiotics soon enough, and months went on, and it's just like this later phase, deep into the tissues and the joints and the nerves. And then for some people, they did get treatment and like go into the late stage. And then for some children is important. And like I said, like, because for a lot of children, it's just can be neuropsychiatric without any of the other stuff. Some children just go right into that. And those are usually the children that have some kind of family history of mental health issues or MTHFR deficiency, with just like a lot of mental health, or autoimmune, like their mother has an autoimmune neurological disorder, or like MS or something like that. Like, it's not usually just sort of that random. Like, it seems random, but then when you look at the family history, you're like, oh, okay, it's not really that random. Or there's just some child that just always kind of struggles a lot in some kind of way, mentally or developmentally, and they might just go right into the neurological stuff. Okay, next slide. All right, so how does Lyme disease affect children? This is from Dr. Jeben Moore. And so you see there is going to be the joint pain and the fibromyalgia. There can be the chronic fatigue, the swollen lymph nodes, the headaches, and the migraines. But then a lot of times we see these, what he is showing, the mental disorders like depression, anxiety, Lyme rage. We can see that in children too. So, and like with Lyme and tick-borne illnesses, it can just change a lot. It can be for some people, it's always the same set of symptoms, and sometimes it's always changing for some people, depending on the co-infections and other things. So sometimes we just attribute it to growing pains or tantrums or terrible twos or depression or other things. So it's just important. I mean, a lot of these kids just get put on medications and nobody really blinks an eye and thinks about Lyme, right? So, and they can have other stuff. They can have rashes, tiredness, headaches, muscle aches, joint pains, slower irregular heartbeat. It can be the air hunger. It could be facial palsy and other, damage to the spinal cord and nerves, numbness in arms and legs. And then a neck stiffness or pain if there's meningitis, like inflammation in the spinal cord and brain. And then the next slide goes into the more details of like the cognitive and neurological symptoms that we commonly find in Lyme disease. And a lot of times it can just be like their schoolwork just starts going down, or their handwriting just all of a sudden goes, gets really bad. But it can be like irritability, depression, short-term memory problems, issues with schoolwork, brain fog, anxiety, easily distracted, light and sound sensitivity, slowed cognitive processing, aggression, rage, and then obsessive compulsive behaviors or rituals. And if you actually Google, and you still like when you Google stuff, I mean, it's really glad this is from Global Lyme Alliance. The other one was from there's other slides I have from Children's Lyme Disease Network, and it's really great that we have these organizations now, because still when you Google like symptoms of Lyme disease in children, they still say like the most common one is arthritis, and it's like in the large joints in the knees, and it's like, okay, that's not true. So it's still frustrating that that's being put out there. All right. We can go to the next slide. Maria, did you put something on there? Oh, Global Lyme Alliance. Cool. Thanks. And And just was I think I said all those. Yeah, said all those things. All right. So this is 2 stories. One is a late stage Lyme story, and one is a happy. It's like when things go well and you get treatment right away. So this was 10-year-old girl I saw up in Vermont, and her family traveled to Cape Cod, and we just get so many tick bites every year. Cape Cod is like one of those bad hot spots, especially certain times of year. And she tested positive for Lyme, Bartonella, and Anaplasma. She had worsening severe OCD, rituals, and it was interesting because we tried at some point we had a frequency machine that we used up there with folks, and every time this one girl went on there, she would her parents said that she would just come back with these like suicidal thoughts out of nowhere. So it was too much. It was like probably made the bugs have a party. So we had to go really like a lot slower with her and back off of that. And she had some fatigue and she had some joint pains, but it was really just the kind of the OCD stuff and the depression and more of like the mental and cognitive symptoms that were really hard for her. And they had to take her out of school, and she did homeschooling for a while. And then I worked with her for a whole year. And then I think eventually they moved. But, she did progress, in the whole year, but it was a bit of a roller coaster, as often it can be with more chronic Lyme, late stage Lyme. And she did eventually got better, but we did a lot of different things. We looked at what was going on with her gut. She had a lot of diarrhea, alternating diarrhea and constipation. So we did a lot of treatment for their gut and gut healing, which helps to improve the immune system that way. We did a lot of different homeopathy and herbs with her, but it did take, it took her a while to get back, and she eventually was able to get back to school after a year. So that was good. And she didn't have any like worsening depression or suicidal thoughts with the other treatments. It was just really with that frequency machine, and just thought that was kind of interesting. How different things can come up for different people in that way. But yeah, she did eventually get better, but it just took a lot more work, and we had to do a lot more to heal her brain and heal her nervous system and kind of reintegrate the body. And then when there's also more later stage illness, it takes a toll on the whole family. And so we also had to do kind of a lot more like family integration and family therapy. I didn't do family therapy, but referring her for that as well. And then the next slide, kind of like when things go right, and we can use a combination of therapies, an integrative approach with antibiotics and naturopathic medicine. So there was an 8-year-old boy who was a patient of mine before he got the tick bite, but he had a tick bite on his left nipple, and it was red, and it was really embedded and difficult to remove. And it was an acute case of Lyme. They had the education, so they knew they needed to send it in to the tick report to get it tested, and they knew like to get it off right away. But it was really difficult to remove. And he had this complex PTSD and trauma going on in his family, and they also been sick with a fever 2 days before the tick bite. So there's a lot of different things going on, but his main symptom after the tick bite was fatigue. And they sent it into tick report, and it was positive for Borrelia burgdorferi and HGA, which is Anaplasma. And Anaplasma is kind of like usually just get a lot more intense symptoms of you get like a higher fever, and can be vomiting and sometimes more diarrhea and things like that. So it could just be like a lot more sick, like sick with Lyme, but then a lot more sick is usually how I see it. But this was like when I saw him, I think it was just a couple of days after he had gotten, they had already sent in the tick report. So it was pretty early on. And they did decide to, they went to a local integrative health clinic where they were able to get the antibiotics, because there were some Lyme literate MDs there. And so they did do the antibiotics because it was embedded they think it was on for a long time, and it was really hard to get it out, and because it had the Anaplasma and the Lyme. So they did decide to treat with antibiotics, but then they also got on the Lyme herbs, and they got on the homeopathics, and they also did some Anaplasma herbs. And usually when people are doing their herbal treatment, it's 6 months, and that's to prevent any chronic issues from developing. So he was fine. I went on he didn't have any issues with Lyme. I kind of helped him with some of the PTSD stuff. He was having like night terrors and bedwetting and other issues. So we worked on that stuff, and really the Lyme and the anaplasma were fine. It didn't seem to have any long-term issues. So that's when everything goes right. And, they did all the things. They got treated really quickly, and so that worked out well. And I believe that they did do the 6 weeks of doxycycline for him. And now that might be a question that comes up. It used to be like we didn't give doxycycline. Doxycycline wasn't given to children under 7 or 8 because it could create like permanent yellowing of the teeth. But now it's like pretty standard that they are giving them doxycycline. However, I just had one of my daughters, her best friend they didn't find the tick, but they luckily had like a really obvious bullseye rash, and they went into their primary and they tried to give her, I wasn't really that involved, but they did try to give her the doxycycline, but she wouldn't take it. So she wound up only taking the amoxicillin, which isn't always, it's like hit or miss. It doesn't always work for Lyme, but so far she's been okay. So, okay, let's go to the next slide. Again, just some more details on the symptoms children with Lyme are more likely to have: lower grades, difficulty mending friendships, greater risk of depression, debilitating pain and fatigue, difficulty processing information, and behavior outbursts or mood swings. And then the next slide just has some of that and then goes into this. I'll read, and this is kind of small. I couldn't figure out how to make it bigger. But this is from, I think Maria sent the resource. This is from the Children's Lyme Disease Network. So you can go there and look at it in more detail if you want. But it's basically, this one I think is important, is children with Lyme have more cognitive and neuropsychiatric disturbances. 41% have suicidal thoughts. And this is age 5 to 13. So incidence of Lyme is highest among school-age children, age 5 to 14. And 11% made a suicidal gesture, which is like sometimes it's just like cutting yourself or harming yourself in some kind of way, where it's like a call for help. You're trying to have a call for help, but you're not actually trying maybe kill yourself, but they call it a suicidal gesture. But it is indicating you want to hurt yourself, and that you could later on want to try to try suicide. And then this one that's hard to see right here, which is related, this is kind of like a little infographic of what I just showed, but saying 79% of children basically lose friendships. And so that's the social piece is a huge piece of it too. And it's not like, not like people are going to say like all of a sudden they're starting to lose their friends, but it's like an important piece of it is that they're, all of a sudden really tired and fatigued and having all these outbursts at school, and they're raging and yelling at everybody and nobody wants to be friends with them. It's just a piece of it. So I'm going to go to the next slide. So this is it's a little visual of my Lyme recovery system. And so you could have all the we start up here with exhaustion, not sleeping well, pains, all the cognitive neuropsych things that we talked about, brain fog, mood swings, whatever. So we have clarity. We want to get clarity first, do a consult, and do some testing. This might include some testing of the gut. And then we have another consult where we kind of go over everything. And then sometimes I'm doing and this is not always, this usually we have to do first because we have to figure out what we're doing, what we're treating. But sometimes this isn't necessarily have to all be in this order. And it doesn't have treating the pathogens on there. But it can. The reason it doesn't is this is a little bit more for like chronic Lyme, where a lot of the time I'm kind of working on these things first with people, like boosting the immune system, decreasing inflammation with diet and herbs, and optimizing the digestion, maybe doing a detox. I usually find that when we're more in we're not in the acute phases, that we have to kind of help. Yeah, there's a lot of inflammation, a lot of damage that's been done. So we often have to kind of help the immune system, help the gut, help the organs that have been damaged first, do a little like recovery first before we're treating the the pathogens themselves. And sometimes when I'm working with people, they're also like have been on a lot of the antibiotics for Lyme or co-infections and just kind of reaching a plateau. So that's often why it's like, okay, we need to kind of do this first. Sometimes we need to like do drainage or detox first, or do building. A lot of people are really weak in certain areas, so we have to kind of build them up first before we're starting to even treat for any of the pathogens. And usually calming the nervous system, like there's this kind of a recovery, calming the nervous system, emotional reset. And usually there's some kind of like family reintegration that's going on at this point, because often with their more difficult cases where there's, just a lot of rage, especially if there's like tantrums and mood swings and rage, and even just like a lot of chronic illness, it can be hard. It's hard on the parent and child relationship. So usually there's some kind of, reintegration that happens in this phase as well, and then decreased flare-ups, and then getting your life back at that point. And yeah, it's a little bit, so it's kind of a different approach that I'm usually taking, and it's really different with each person when I'm doing. Sometimes, especially the more acute phases, we are getting right on top of those co-infections. But then if there's some kind of anything that's showing up right away, in the brain or the nervous system or in mental health system symptoms or anything, then we're also kind of wanting to treat the whole person, right? So we're also kind of treating for those things as well, not just the pathogens. So we can go to the next slide. And so calming the nervous system is just a huge part of this, especially with children. And like someone said, they respond really well. Even like some of these chronic cases with children, they respond, depending on how long it's been, of course, but respond really well. And we really have to address the brain inflammation. Nervous system must be balanced so your child can feel like themselves again, and they can get their mind and their body back. And I use a number of different tools. If I'm seeing people in person, I do craniosacral therapy, and that's like one of my number one tools for brain and nervous system healing and reset. I do use a lot of medicinal mushrooms like lion's mane and cordyceps and reishi. Sometimes others, and then a lot of herbal nervines like lemon balm and ashwagandha. But usually I'm also doing a lot of homeopathy in there as well. And that's kind of, I think, more where the juice is, so to speak, especially with these more chronic cases where they just get stuck, the children just get stuck in their nervous system. I do constitutional homeopathy, and that's kind of like part of the 90-minute intake that I do with folks. That's very individualized, and there can be hundreds of different remedies that I could choose on that, but I find that is one of the most helpful things. And then some people also just do really well with, some people are just doing homeopathy and craniosacral, and in terms of nutrition with children, depends, like with the sometimes like the children, the symptoms are the food. And so then we, if there's any eating disorders or picky eating, we're not going to really be able to do a whole lot with that until some part of their brain gets a little bit better. And then we can start, but sometimes that's like, the sugar, just eating sugar on the food cravings, like a lot of that time, that's the bugs going kind of crazy. So, all right, go to the next slide. And so what I find is most missing from a lot of Lyme care is not addressing the weakened organs and systems that have been damaged. And I think the shortfall is just staying sicker for longer, missing school, losing friendships. Okay, and then the next slide. So these are some of the herbs I've mentioned before, just within pretty pictures. So this is Japanese knotweed, which is a great herb for brain inflammation, cognitive issues, also joint inflammation, and it's the root that we use. And then this is cat's claw, and I love this picture here because it really shows the, it's like nature's law of like, we look and see, oh, what does it look like? And then it actually has that name. And I feel like that it just looks so much like a spirochete to me. It has that spiral shape. And also kind of looks a little bit like nerve cells. But I think it's interesting how it has that affinity. It's used, it's a South American herb, and it's used in cancers too, in South America, but it has an affinity for the brain and the gut, and it's in kind of a lot of the basic Lyme formulas. And this is andrographis down here, which is a great herb for when people are really fatigued and cold and debilitated. It's really great for that, like mono Lyme fatigue with swollen glands. It's also antiviral, so can be used for a lot of chronic viruses and even like long COVID and possibly other ones, like, when there's Epstein-Barr virus alongside of Lyme, and we have the chronic viruses that sometimes come in when you have chronic infection. Alongside of that, the andrographis can be really nice, but it's also part of like a basic Lyme formula that I use. And then this is like a historical drawing of astragalus, which is in the bean family. It's the root that we use, but they don't have a picture of the root here, but it's a great Chinese herb that can be put into soups and teas, and it's very mild tasting. It's also part of my gut healing formula, but it's one of those like immune boosters that I use a lot for acute Lyme, but it's also antiviral and can be used preventatively. And this is cistus and canthus, which people might be familiar with, which kind of used for more of the chronic cases of Lyme when they're just when the Lyme is just like really deeply embedded in the tissues and it's not in the blood and it can be hard to treat. The cistus kind of helps. It's kind of could be similar to like a systemic enzyme therapy, but I don't do that as much with children. And so the cistus can just help kind of break up some of the Lyme colonies and mobilize the Lyme from the tissues and bring it out. So it's easier to treat in certain cases where the Lyme or co-infections are really deep in there. And then the next slide, just kind of briefly, like botanical medicine, I think the number one reason to use it is like it works, used all over the world, safety record. This is wormwood, which we use less in children, and you have to be careful when you're using it and you have to take breaks from it because it can cause liver damage. But it's one of the ones for babesia that we use. People might be familiar with like artemisinin, but use that less in children. But in older children or in teenagers, it's usually fine. But there's a lot of synergistic effects with a lot of these herbs. Like we know Chinese skullcap and a lot of the basic Lyme herbs, they actually help the antibiotics work better. They help prevent side effects. They're anti-inflammatory, immune modulating, and most of them are safe. And then next one, turmeric is also kind of a go-to that a lot of people are familiar with and know about. You don't want to use it with any NSAIDs. Can cause dizziness. So if there's, you're using it for pain, you can't use it at the same time as which you're taking like Tylenol or anything. But it can be a good alternative to that for pain. And so it's also great for the liver. It's good for digestive issues, pain, inflammation, so you can feel better, have less pain, more sleep. And then other targeted therapies for organs, a lot of times we need to help the liver and the kidneys. So I use milk thistle for liver and kidneys. Milk thistle can really be restorative to the liver and get those liver enzymes down pretty quickly. So it does, a lot of these things work well and have a good safety record. Okay, next one. And just briefly, a lot of you guys might, if you're Lyme literate, already know about these, but 9 reasons why you or children might still be sick after antibiotics, or having negative labs, like conventional labs, not like IGeneX or anything else like that, but typically not getting treatment soon enough. Usually we want to get treatment within 72 hours of noticing symptoms from a tick bite. Unknown co-infections, not testing, not treating, too much reliance on labs. So like I said, that's why we send the tick report in, get treated sooner instead of having to keep waiting and waiting for labs to come back 4 to 6 weeks later, because we don't, as humans, we don't produce our antibodies to Borrelia or any of the co-infections typically 4 to 6 weeks later. Antibiotic resistance is very common. There can be autoimmune activation, chronic viral infections, depleted organs, and sometimes mold illness, living in moldy places or having lived in moldy places kind of just complicates things. And there's colonies that can form with heavy metals and mold and Lyme, and it gets harder to treat it. Okay, I think we're coming to the end. I don't know how long I've been talking for. Antibiotic resistance is common, like I said, not getting the treatment soon enough. Some people also with doxycycline, I forget the percentage. Some people have antibiotic resistance right away with doxycycline. Some people have like antibodies to it. So it's not always the go-to, and working with a Lyme literate doctor is advised. Round bodies are common when there's long-term antibiotic use, and that's like where the spirochetes it's one of the things they do to protect themselves, is they form little balls like that so that they can't be treated. And that's where the cystis can help open that up too, that the herb we were talking about, so that the antibiotics can get in there. Inflammation damage is common, and scar tissue can form too, which also makes it hard to treat if there's scar tissue in the way. Okay, next one. So you or your child can be sick, have Lyme, even with a standard course of antibiotics. There is such thing as chronic Lyme or post-Lyme disease syndrome. So for a lot of children, long-term antibiotic therapy is not indicated or effective, sometimes dangerous, and there are other holistic treatments available that can work alongside that. Okay, and then the next slide. And so my unique approach is really trying to identify the cause or causes, using customized botanical medicine, homeopathy, identifying and treating weakened organs and systems. And then the next one. So we're wrapping up here. So we've talked about the top tips to prevent Lyme disease, what to do if you find a tick bite, what the different phases of Lyme tick-borne diseases might look like in children, what the symptoms might look like, how they're different, and then a little bit about my unique 9-step approach to Lyme recovery. And we can go to the next one. And then again, I'm typically assessing and treating weakened, depleted organs and systems, balancing the nervous system and the immune system, decreasing inflammation, healing the gut. And then who is this not for is if you or your child want to just only keep taking antibiotics and don't want to do anything else. You're opposed to herbs or dietary changes. You want to keep doing what you're doing. Don't want to take an active role in their healing or your healing. And then this is designed, Lyme recovery system is really to get your life back, have less pain, get back to school, get back to work, get back to your life, make friends again without just relying on the medications. And then you can book a free 15-minute consult. So like I said, we only have so much time here today, and it's not a medical consult. So we can discuss your child's health concern, determine if it's the right choice for you, answer any questions. And then after that, we would book a 90-minute initial consult if you wanted to work together to get you started on your healing journey and your family's healing journey. And I did want to do, if it's possible to stop this screen share, I wanted to just quickly show my website, or you guys can go there, whoever wants to do it. Okay, perfect. So I'm gonna share my screen. Here it is. Okay, can you see that? Yes, okay, perfect. So at the top, it has the website, you can go call, and then you could hit the book now button, or it's under services, appointments. And then all new patients need to schedule a free 15-minute consult. So then you just go to the bottom here and you select a service. So you would click on the free 15-minute consult. And then you would see, like I said, you want to do Thursday at 10:30. and then you put in all your info, your child's info, you hit next, and then it takes you to fill out a questionnaire, and that's it. So there's, oh yeah, that was what the last slide had on it, was just my info. I had my email on it as well. And I think that you all will receive or did receive a handout that should have my information on it as well.
We'll be sharing that.
Yes. Okay, great. Perfect. So yeah, so I think now we can go to questions. Or we only have, do we only have 5 minutes left? I lost.
Diane.
Yeah, I'm wondering, when you're saying, for patients to get tested 4 to 6 weeks, is that after treatment? And can you get tested while you're on treatment? Will it skew the testing?
Yes and no. So I don't want to tell people to not get treatment so they can get tested. Right. Typically, if you've had, if you've been on antibiotics, like if you've been on doxycycline and you've had Lyme in the past, then your labs could some people just always continuously show, and then you won't really know if it's hard. It's not always obvious, clear if it's like a new acute case. Sometimes it is, where it's like everything is in the, IgM category. Everything is in the like acute antibodies, and nothing is in the chronic, and nothing showing for the chronic antibodies. But yeah, I usually say, if you've been on antibiotics, it's like, because it's not always cut and dry. Some people are on doxycycline, but then that doesn't covers a lot of the co-infections, but it doesn't cover babesia, for example. And then it's like, well, if you have all these symptoms of babesia, we should probably test. Or sometimes if people can't afford testing, sometimes we just do like a trial of herbs for that and see if that helps. So the testing is helpful, and then some people are, if they're just doing testing, conventional Western blots and conventional antibody testing, like through LabCorp or whatever, what is it? One of the tests, I remember now, if it's LabCorp Quest, they don't test for like all the bands that show up for like the neurological Lyme. So, yeah. It's definitely better to go through IGeneX, but then not everybody can afford that. So sometimes we just test, we kind of just treat I do a lot by the symptoms. I'm like, okay, it seems like you have a lot of the classic babesia symptoms. Like, let's try to treat for that. So yeah, I do recommend it.
Thank you.
I just wanted to make a few comments. In my experience, there's tremendous limitations to tick reports. And if you understand how a tick bite works, the first thing they do when they bite you is put an anesthetic into the bite site so you don't feel it. But the second thing they do is they regurgitate and basically vomit their entire stomach contents into you. And that's in preparation for sucking your blood and filling their stomach with your blood. So I see lots and lots and lots of negative tick reports because the tick already injected all of the pathogen into your body, so they don't have any more pathogen in their body. So that's just a word of caution about tick reports and relying on them for deciding whether you're going to treat or not. It's also important to know what the percentages are in your area. In my area, nymph ticks have 85% pathogens. Adult ticks only have 50% in my area. So any tick bite, you're going to take that into consideration. Doxycycline has been shown to be, Borrelia in particular is very resistant to doxycycline. And even one dose of doxycycline before testing will make the test results be negative. They did a beautiful study that was published in 2020 where they took about 8 different antibiotics and about 20 different herbs And they put Borrelia into a petri dish, and they put each of these medicines into the petri dishes. And after 24 hours, doxycycline only killed 30% of the bacteria. But the most effective antibiotic was cefuroxime, and it only killed 40%. But the most effective herb in that study was cryptolepis, and it killed 85 to 90%. So I don't find doxycycline to be very useful unless you know you have anaplasma or Ehrlichia. Um, and I never give it to a child younger than 8 because their teeth do turn brown, and it's a permanent problem. Anyway, those are some of my comments about it's just I have a different approach, but it's based on scientific studies that have been published.
And there's more recent research too. And it's very exciting post-pandemic that there's some great research for Lyme disease, co-infections, and it sounds like Nitya is keeping up to date with her studies, having to, did you say 50 hours
Yeah.
of research,
Continuing
education?
education. Yeah, I just a couple of things. I think the tick reports. I don't know which tick report you're using, and I think those would be great questions to ask a Paul. But I know that in the past when I've asked them, they always say it's like 99% accurate. And I would say in terms of practice, because I think and it's not like right or wrong. I think it probably depends on the technology and the different companies. I'm guessing because. I mean, he used to work, it used to be through UMass, through University of Massachusetts. But anyways, in my practice, I'd say like probably 95% of people are testing the ticks. And there are once in a while where it's like, okay, you have a bullseye or you have these obvious symptoms and the tick report is negative. So we'll just, we're going to treat you because you have the obvious symptoms. So yeah, it's definitely with a grain of salt, but like if you have really obvious symptoms and your tick report is negative, then you should still treat for sure. And then, yeah, there's definitely more and more issues with the doxycycline, and the Ceftin is also just really kind of more appropriate, I think, for children and and then the breastfeeding mothers and stuff. And then there's other ones too. Yeah, that's cryptoleptis. I haven't. I have some patients that have just I've done that. That's why I find the herbs and the antibiotics together are like a better combination. And the cryptoleptis, I don't know if that's appropriate for using in young children.
It seems to work fine,
Yeah.
and it doesn't seem to have any side effects
Right.
in my experience. But
yeah, awesome.
It gets them feeling really much better pretty quickly. So it's nice to give them something that makes them feel better right away.
And as always, it depends on the patient, it depends on their reaction, dosing and body type.
Yep.
Natalie, did you have any questions?
Just about myself, which I don't know if that's appropriate, but in my area, it's very difficult. I'm in on the South Shore, and it's very difficult to find once you have a tick bite to get treatment. I went to an urgent care, and I said I got a tick bite. I had chills within a month afterward, but I was confused because I was going through menopause and I didn't realize that I probably shouldn't have chills. I was having both hot flashes and chills, and that maybe, the chills were not hot flash related. But I can't have the doxy. So I said, in the past, they've given me amoxicillin and I had to beg for it. And I was having hand pains and a little knee pain as well. But they said, you're not having fever right now. You're not. Anyway.
Mm-hmm.
So
yeah, well, you might be somebody that needs to have the herbs on hand, and like the cryptoleptis might work better for you. And then you're also somebody that probably should have, if you can't, there are a number of Lyme literate doctors that do take insurance. Some take insurance, some don't. But like you could have anybody that's in Massachusetts prescribe for you. You could just you need to find a doctor that you can work with to get you the prescriptions.
I did look into people in my area, and they all.
But they don't have to necessarily be in your area. I mean, it can
Right.
be somebody in this part of the state.
We can help you find somebody that's appropriate for your insurance and
Okay,
ability.
so if I end up in another situation,
Absolutely, we can help.
Okay.
Connect you.
And I was interested in learning more about what you had said you use as the no-dose.
No-sode.
No-sode.
Yeah, it's called the tick pathogen no-sode. You can usually you need an account. I wonder if I have it on my. Let's see if I have it on my website. I used to. Oh yeah, here I'll share this with you. You can sign up for FullScript, which is an online supplement platform, because you can't get that retail. You can order the tick kit through emailing me or calling me if you want all the herbs and the remedies and everything. But if you just want the no-sode, you can go to my website here, the cedarroseheals.com. You don't have to go to the appointments, but just cedarroseheals.com. If you go to the bottom, you can go to purchase supplements, FullScript. Anybody can sign up with an account. You get 15% off. You don't have to be a patient. I have people that are on here that aren't patients. And then you can get the tick pathogen no-sode on there, and you can get other supplements on there as well. So.
And that other thing you said you have, the tick kit?
Yeah, the tick kit I have.
Do you have an online shop for that?
I don't have one yet. I'm working on it. If you wanted to order it, I would just say just email me and I can mail it to you. We do like an invoice online and I mail it to you. So
does it explain what's in it on your website?
Yes, it does.
Okay.
Let me see where it is on the website. There's I think it's, yep. So I shouldn't stop sharing, I guess.
We'll share the link when we email everyone.
Could you speak to treating pregnant women? Because I had a recent case where somebody who had Lyme got pregnant, and I could not find safety data on any of the herbs that I use.
Mm-hmm. Yeah, I think for the herbs, you can't really use. I think the only thing that was used in that case was like astragalus, maybe. You can't really use any of the typical herbs. I'm trying to think if I. I think it's typically, and I think for I don't really treat a lot of pregnant women, but I do know that like you can't use like a lot of them are not being researched, right? So I think for safety, most people just stick with like the Chinese herbs because they do research that, those are more heavily researched. So I think we just use like antibiotics and probiotics and other supportive things for the immune system that we know are safe. Like you wouldn't want to use systemic enzyme therapy in pregnant women. There's, it's kind of really, it's more limited. I think we just did astragalus and then antibiotics, and probiotics, and then probably acupuncture,
right,
or craniosacral, like if there's pain. So
yeah, the only mainstream antibiotic that has support in the literature is cefuroxime.
Mm-hmm.
But pregnant women who take cefuroxime for the duration of the pregnancy have a much, much, much lower rate of miscarriage birth defects,
Yeah.
abnormalities in the newborn,
Yeah.
etc.
Yeah. Septin is a good one. Definitely.
Yeah.
Yeah. And it can be tricky, depending on when they get pregnant. Like if it's in the first trimester and there's a lot of morning sickness, that all makes it more complicated. I don't really treat a lot of pregnant women. But just that on the website, if you go here to where it says ticks are out, this is just I like news and blogs over here. And then this is just about the tick kit and like how much it is and what's in it. And this is about the talk today. This also has we're going to be doing another urban play children's plant medicine and play workshop in June, just for anybody who's like local and interested. All right.
Jesse, do you have any questions before we close out for the day? No,
Hi, I'm here. I'm slow with
that's okay.
it's hard for me to navigate the computer. And I apologize, I don't have my screen on because I have light sensitivity. But I don't at this moment. I've been listening really closely and I just really appreciate it. I think I do have a lot of questions, but I don't know if I have anything like formulated yet. So I might consider doing like a consultation with you possibly. I mean, I believe in the methods that you're presenting, and I guess one question I have is it ever possible that a child, like you presented the example of the child who was in Connecticut and had like a bunch of bites and stuff like that. Is it ever possible that a child gets bit more than once and doesn't develop symptoms? I mean, I know that's kind of like the luck, would be like a really lucky scenario, but I just wonder.
Well, I guess it depends, like how far apart the bites were, and what kind of tick it was, and
Yeah,
all of that.
right.
I mean, I've had my multiple, like she would find a tick bite on her. We would find a tick on her, like we'd find dog ticks on her, like once a week on her head. Like
Oh, wow.
1 or 2 years ago that happened, and she never got sick.
Okay.
But I'm also giving her tons of stuff all the time. I'm always treating her. But she really never developed any symptoms from them, but they were all dog ticks. And where we lived, like, again, I kept all the dog ticks and we sent them all in. They're all negative. So, and she didn't have
Okay.
symptoms. So those two things, and, she's taking a lot of the herbs and the no-sode and everything preventatively. So
Right.
I think it is possible, but it really depends on, there's some people that it really depends on the type of tick it is. Cause then the other child that I was saying, the 8-year-old, like actually he gets, there's some children that are getting the tick bites like every year, and then they're getting on the antibiotics every year too. And then that's not good either. Right. So, so I think it really depends on where you're picking up the ticks, what they're carrying. There's a lot of factors.
Thank you.
Yeah.
So, what did you say about the no-sode? Is that how often do you take that?
Well, for prevention, it's usually just a couple. It's on the bottle once you buy it, but so I just say follow the directions on the bottle, really. But it's usually just a couple of drops once a week for prevention, and then if you do have get a tick bite, you take it for a month, and then it's a couple of drops, a couple of times a day, away from meal. With homeopathic remedies, you have to do 20 to 30 minutes away from everything else, like food, drinks, toothpaste, gum, medications, herbs, anything else. So, yeah.
Thank you, everyone. Great questions, great input. Claire, thank you for sharing about your practice as well. Nitya, thank you so much for coming today. Really appreciate having you present for us.
Yeah, it was really great to be here and meet everybody. And yeah, you can reach out to me on my via the website. There's a contact form if you have any other questions, or email. And then you can also, if you want to do more in-depth conversation, you can set up a free 50-minute consult. So, yeah. Take care, everybody. Stay healthy.
Thank you so much.
Yeah. Bye.